Hi everyone. How is everyone doing? I hope you can hear me well this morning. We are so excited this morning. We will be talking to one of the best experts in the industry, and I see she's online already. That's Lynne Bluff of the Expectant Mother's Guide. Drop me a thumbs up if you can hear me, somebody, please. I'm so glad to see that you're joining us. Hi Warren, please drop me a thumbs up if you can. I would appreciate it. Can you hear me okay? Let me know. You can. Thank you, Bron. How's it, Bron? Bubble Pop. Hey, Bubble Pop. Thanks, Warren. I'm glad you guys can hear me. I'm just going to give it a couple more seconds, say 30 seconds or so before we start with Lynn. I'm going to invite her very shortly. As I said earlier in my post, this is kind of the best time or the best live talks for all our expectant parents, because the truth is no one can afford or no one can go to antenatal classes at this time. So these Mama Magic Insta Lives are exactly what expectant parents need. So I'm so thrilled for all the mums and dads expecting out there that they're doing this for you. I am just getting some questions ready for Lynn. I know Lynn's ready. Hi, Lynn. Okay, Lynn, I'm going to go live with you. She should be joining us quite shortly. Aha, there she is.
Hi there.
How are you doing?
I'm doing really well, thanks. And you?
Excellent. It's so lovely to see you. I haven't seen you since the Experts Lounge for a couple of years now at the Mama Magic Baby Expo.
Yes, it's nice to be back connecting with you and connecting with Mama Magic in a different way.
I know. It's amazing how things have changed in such a short space of time. But I'm so glad that the experts like yourself and Mama Magic are on hand to give our parents exactly what they need during a difficult time.
Sorry, can you still hear me? I was interrupted there.
I can hear you 100%. Don't worry about it. Lynn, I'm going to dive right in. For those of you who've joined us, thank you so much, everyone. As I mentioned earlier, Lynne Bluff is one of the most trusted voices in the industry. And I don't just say that. She is a qualified nurse, midwife. Lynn, you are the founder of the Expectant Mother's Guide. Don't you just want to tell our parents a little bit more about yourself?
Yes, I am just so passionate about getting good information to pregnant mums and dads, so that they can actually have the best experience of pregnancy, of birth, of labor, of parenting that one can actually do. Because really, you can start off parenting on the correct foot, or you can start it off on the wrong foot. And we want to start off people on as good a foot as possible, because parenting is normally a really difficult job. Parenting with COVID-19 around is really extraordinary.
Yeah, absolutely. And you know what, Lynn, something I read a few years ago when I was just entering motherhood myself is that the biggest role we'll ever play in our lives is that of a parent. And that's the one thing that we don't do enough or study enough to prepare ourselves. So thank you once again. So let's get into it. Today, the main theme of our conversation is really skin to skin. So Lynn, off the bat, first question, some parents might be asking, what is skin to skin?
Yes, isn't it? And it's just such a beautiful image. I wish we could put some images up here of what a baby and mom or a baby and dad are skin to skin. So if you just think of this beautiful newborn baby in the nude, and it just gets put on mom's chest as she lies in the nude, or her shirt unbuttoned, and just this beautiful warm little creature close to your heart against your skin. That is what it really is all about.
So it's really just as simple as that, is having your baby on your skin.
It really is. It is simple. simple, it is uncomplicated, but yet it is something, it's the most powerful thing that you can actually do, and the best thing for mom and baby immediately after birth. So it's as easy as just having baby on mom's chest in the nude while mom's chest is in the nude.
And you said this immediately after having baby. That's the best time, am I right?
Absolutely, immediately. You don't want to interrupt this process for anything. Medical interventions are not necessary in an uncomplicated birth. That baby should just be put straight immediately on mom's chest, skin to skin.
And Lynn, while we're saying this, I'm just going to, for all the parents who are online with us right now, if you've got any questions, Lynn, I know you're happy to answer them. Please drop a comment in and I will do my best to get to those questions as we're going on through our conversation. Now, Lynn, you said immediately, there's a very special time between mom and baby, that precious golden hour. For skin to skin and more, why is that golden hour so important?
It really is this transition and this first impression as this baby is born. And this first impression is going to take this baby's image of what life is actually all about the second that it is born. So is it in a loving, welcoming environment, or is this baby being taken away by a stranger, separated from mom, which is actually a really, really traumatic event, and that will reflect in this baby's life forever, that actually the world isn't a welcoming place. I'm not happy and stable.
Wow. And Lynn, you know, we are in an era where I think women are taking more control of their births. But say, for example, mom doesn't, or she thinks she doesn't have a say over that time. Maybe she's having a C-section. I haven't had one myself, but what do they do during that time? Say baby gets taken away, do they have a right, or how do they get back into the skin to skin post something like a C-section birth?
Well, if it's a cesarean that is a non-emergency, so it's a booked one, we're expecting it, one can have a discussion with the doctors up front and say, my desire is to have a skin-to-skin Caesar. Okay. And then they know that actually, let's prep this mom ready. So we have a gown that is not over her chest. The monitor leads can be put on her back, not on her chest. That she can have her grip and her arm in her non-dominant arm, so that she can actually hold her baby in the correct arm. And so there's a lot that one can actually do to do this. I mean, there are some doctors who are just phenomenal, that actually they walk this baby out as this mom is having a Caesar, so that it's getting some of the movements, some of the feelings like going through the birth canal, so that they try and get it. That some of the doctors even let the moms actually participate in this, so that they can see it, that some of them are making holes in the drapes of the Caesar, so that mom can look through, that baby can actually go straight to mom. So we've always got to realize that with a cesarean, baby is more at risk. It's not a normal life event, and so they just need to obviously make sure that baby is breathing correctly, that there are no secretions in the way, and then pretty much mom can have baby almost immediately, skin to skin. Obviously not like one would with a vaginal birth, where baby's head would be on mom's chest between her breasts and baby down in a vertical position. But with this, because obviously that's where they're working on the Caesar, but baby would be put horizontal across mom's chest, but it would still get some of that skin to skin and effects of the important effects of that mom's chest.
That's wonderful to hear. And all the research that's coming out around that's spectacular, that doctors are giving moms that opportunity, even during a C-section birth, which is just amazing. And Lynn, this brings me to my next question. Something like skin to skin seems, forgive the term, low tech. You know, we're kind of bored with it. But it has incredible benefits. So why is that skin to skin time so important?
It is incredible the physiological effects that actually happen both with the mom, but particularly with the baby when baby is skin to skin with mom. That actually there's something called thermal synchrony, that mom's chest actually feels the temperature of that baby's skin and adapts her skin temperature on her chest to accommodate the baby. So if baby is cooling down a little bit and isn't as warm as it should be, mom's chest then has the ability to increase her chest temperature by 2 degrees in order to warm that baby up. And even reverse can happen, that if baby gets too warm, mom's chest temperature actually drops by a degree to actually cool that baby down a little bit. It is amazing. And the baby's breathing, baby's heart rate, that actually stabilizes being on the mom's chest. And
nothing short of miraculous.
Absolutely. And the exciting thing is this is low tech. This is available to everybody, you know, and sometimes we don't appreciate the low tech things that we are actually made with and come naturally, that it's available to everybody, whether you're rich or poor.
Precisely.
Really exciting. Yeah.
Without doubt, Lynn. And you're talking about these things and saying, you know, that when mum has baby on her chest, she can regulate the skin temperature. But there's something else that happens, baby's brain development. Please, can you just talk to us about that and why skin to skin is important for that aspect of it as well?
Yeah, because when baby is skin to skin and he is relaxed and happy and there are good hormones being released in both mom and baby because of this effect, baby is stable, that actually the hormones that are circulating in mom and baby are positive, and actually it causes the correct growth and development of the baby's brain, even at that stage.
So if somebody says mums are superhuman and superwoman, it's 100% true. Mums, if you're online, if you're online, drop us a comment. Lynn is, as I said, one of the most trusted voices. So please ask your questions. It is such a privilege to have her with us live. Lynn, the other thing that my husband used to do actually, and you know, at the time, having worked alongside Mama Magic for so many years, I had a little bit of an advantage with the information that I had when I did have my first daughter. But I remember very clearly my husband at night used to zip our few days old baby onto his chest in bed at night and lie with her. And when people said, you know, I'm so tired, I'm not getting sleep, I never had that. Is that perhaps one of the reasons why?
Oh, absolutely, without a doubt. You know, mom's going to sleep better, dad's going to sleep better, baby's going to actually sleep better. And so everybody is happy in this little cocoon of this new family.
And I love that. I love that you say cocoon, and we just touched on dads. So dads can do skin to skin as well.
Oh, absolutely, without a doubt. You know, immediately after birth, it makes sense for mom to get the baby first, because in that first hour or two, baby needs to go through those non-instinctive stages that really end up in breastfeeding. So it makes sense that mom gets baby first. But once baby has actually suckled at the breast and settled down, there's no reason for dad to, you know, to be able to be involved and do skin to skin right there and then, you know, and continue that.
I love that. So for the dads who are online, or mums go back and tell the dads, they can practice the skin to skin with you. But Lynn, you mentioned something now that really piqued my interest. You spoke about the 9 instinctive stages during that skin to skin time. Can you tell us a bit about that?
Yeah, it's incredible. You know, a baby knows exactly what to do. A baby is hardwired to know how to breastfeed. And so it's instinctively. Okay, so these aren't learned behaviors. It is born with the ability to go through these 9 instinctive stages, as long as baby is put in the correct place. And the correct place for a newborn baby, we've said, is to be skin to skin on mom's chest. And then baby needs to be left there undisturbed, and it will go through these stages. The first one we've all heard about and know about, the baby's birth cry, you know, wah, wah, hello mom, I've arrived. Okay, and then baby settles down and goes into a relaxed stage where baby just takes a deep breath and says, Ma, where am I? What's just happened to me? But he's nice and relaxed. And then he goes through stage 3, which is the awakening stage. And he starts to look around and take in his surroundings.
Okay.
And then he goes into stage 4, where he is looking at mom, taking in, you know, who it is, listening to mom actually talk to it. And then baby's going to go through stage 5, which is just resting. Gee whiz, this is a huge, busy environment. I need a break from this, otherwise I'll become overstimulated. I'll just take this in, work it all out, and then when I've caught my breath, I'll actually continue. And baby then grows into stage 6, which is crawling. And people say, no, newborn babies don't crawl. But this baby is able to leapfrog, push up with its legs, as it actually can move from being placed low down on mom's abdomen. It is able to move by itself all the way up mom's abdomen, up mom's chest, find her breast, and actually latch on. And so baby is mobile. We don't give birth to a baby like a sack of potatoes and it just lies there like an inanimate object. But rather, baby is an active participant in this whole process. And then baby crawls up and is in the area of mom's breast, and he starts stage 7, which is familiarization, as he actually has a look at mom's breast, familiarizes himself with this nipple before he actually latches on. I mean, do I want this? What is this? You know, and he experiments with it, and he pinches it, and he touches it, and he licks it before he actually goes into stage 8, which is suckling, where he's able to open his mouth and latch on all by himself and suckle from the breast. And then he ends up stage 9, which is sleep. When you're satisfied, you loved, content, got a full tummy, what more blissful way to end it with a nice sleep. Still skin to skin on mom's chest.
That's
where
beautiful.
I'm loved and secure.
That is amazing, Lynn. And you know, you talk about, so those 9 instinctive stages, and those 9 instinctive stages during skin to skin shouldn't be a time we rush, am I right?
Absolutely. So put away your phones. Forget trying to instantaneously tell people you've had your baby, and rather take this time to get to know your baby and your baby to get to know you. You know, if mom and dad have been really participative in this pregnancy and talk to this baby will recognize their voices, recognize them, want to interact with them. And so don't rush this. Don't try and get onto social media, but put things away and just take time out as the 3 of you to actually say, this is my new family.
Wow. And Lynn, I have a question for you. You know, we're in quite a different time with COVID-19 and lockdown. There's a lot around staying safe and extra precautions, and mums are actually quite nervous. I had a friend who actually gave birth last week, and mums are nervous about the hospital. What advice can you give to them for this time in particular?
It's a very stressful time. And what is really worth thinking about, if you are having an uncomplicated pregnancy, expecting an uncomplicated birth, is that have a look at your options of a home birth, because it is a much safer environment within COVID-19 era. And so that really should be on your radar to explore that as an option, a midwife's birth, a home birth, where you're not going into a strange environment, you're not mixing with too many people, you are not actually going into an environment that is potentially infected. And so that is a really good option to look at and explore. And if that isn't an option, take as much precaution as possible. Chat to your doctor and the staff, because some of the hospitals are limiting who is allowed to go in with you. Some hospitals are allowing a partner. Other hospitals are not even allowing the dads in. And that is really quite drastic. And if we look at where we are within COVID-19 in South Africa, we are really just in the beginnings of it. And in the next few months, if you're giving birth, it's going to be a lot more drastic. There are going to be a lot more infections around. And so you're going to have to take increased precautions. The other thing is that when you actually have your baby, is that if everything is fine, try and be discharged as early as possible to go back to your safe environment. Some of the hospitals, again, are not allowing doulas or birth companions or lactation consultants in with you. So make sure that you can connect with them via,
via Zoom or
WhatsApp, or WhatsApp video calls, so that they can actually see how you latch. But the good thing is there are antenatal classes being conducted via Zoom, so you can still connect with some of these professionals. Learn about breastfeeding, make contact with a lactation consultant during your pregnancy, chat to her, so that the second you have a problem with breastfeeding, you know exactly who to call. You can do a face-to-face consultation on WhatsApp or FaceTime or anything like that. They can see how that baby is latching. Once you are home and you need a consult, they could actually come into your home and have a consult with you. And so early discharge is a very, very good option. Some medical aids even pay for midwives to come and do some home visits because you are having an early discharge.
Oh, well, that's such good news, Lynn, because I know that is a concern during this period of time. And just now getting back to, can you believe we've been chatting for 20 minutes already? But getting back to, and I know, for the parents online, if you know Lynn, this is something she's so passionate about. She could talk about this the whole day. And Lynn, you mentioned the platforms. And of course, Mama Magic has got some wonderful Insta lives that they've done with all sorts of advice for the parents during this time, which is just unbelievable. It's gold. But Lynn, getting back to the skin to skin, what would you recommend? How long does one actually practice skin to skin for?
Well, don't forget, immediately after birth is the best time to start, and continue with mum and dad, taking turns 24/7 as much as possible for the first 3 to 4 months. And even after then, remember, don't we as adults still love to be cuddled and hugged and have skin to skin with our partners? And so don't forget that. Your babies, your toddlers, particularly if they're feeling actually scared, wondering what's going on, why they can't go to granny, why they can't actually leave home. Never forget how important skin to skin and hugging and touching your baby in a loving, gentle way actually has on them.
That is wonderful advice, Lynn. On behalf of Mama Magic South Africa, thank you so much, Lynn, for giving of your time, your expertise. It's always a pleasure to tap into that resource, your mind, for all this information. So thank you so much for joining us today.
Only a pleasure. And I'm so passionate about it. As you say, I could carry on for days and hours, to actually talk about it. So go and put it into practice, and make a difference to your new family.
Wonderful. Thank you so much, Lynn. And to you parents, you can find Lynn at the Expectant Mother's Guide. That is her Insta handle. So please go and drop her any personal questions you may have. Again, thank you so much, Lynn. Take care. Bye.
Bye. Bye.
For joining us, everyone.